Midwife Caroline here. There's this question here. I don't want to show I just want to hide identity. I gave birth 10 days ago. When I cough or sneeze, my urine is leaking. I cannot control. Is it normal? Well, it is normal after delivery. Why? Because, due to that overstretching of the perineal muscles, they become a little bit weak. That is why you're not able to control urine. Okay? That one happens. Especially sometimes you may also feel the urge to pee. Then before you reach the toilet, a few drops have already come out because your muscles are still weak. So what you need to do is just exercise, do the Kegel exercises, a lot of squats. Those are, any exercises that normally focus on your pelvic area or your pelvic floor muscles, they really do help when it comes to this kind of problems. The Kegel exercises whereby you, how when it comes to the Kegel exercises, use your vagina muscles, the muscles around the perineum. You like squeeze them like this, okay? You can squeeze like for 10 seconds and then you release. You squeeze for 10 seconds, you release. You can try this even when you're seated down, when you're breastfeeding your baby. You squeeze, release. Squeeze, you release. You squeeze, you release. This one is really going to help them. They'll become stronger. But this one also your diet, things like eating high protein diet that helps to repair the tissues around there is very important. However, remember, stretching exercises, the squats and the Kegel exercises. And also, if you find like it's too much, you can go to a physiotherapist that can guide you with the kind of exercises to do. But these are the exercises that you need to do, the Kegel exercises. That's why I always tell mothers during your pregnancy journey, it's important to exercise because once you exercise, your muscles become more stronger. And exercises especially that focus on the pelvic floor muscles. I mean the squats, the walking, the stretching. I mean anything that is focusing on the pelvic floor muscles really helps to strengthen the muscles of the vagina, muscles of the perineum, because these are the muscles that are, even the muscles of the anus, these are the muscles that are affected during the birth process. You may also find sometimes you may have that urge to poop. You go poop, but when you are trying, like, when you are pooping and then you try to cut off the poop, you're not able to cut it off completely because the muscles around there are still weakened. So exercises is the only thing that can help you to control or to gain back the elasticity of those muscles. That's why I always urge mothers, exercises are very, very important. And it's important to start even way before you become pregnant. But if you have not started, start them as soon as today, so that by the time you go to give birth, the muscles around there are more strong, okay? You see, when it comes to these issues of pelvic floor, the pressure pains are also brought about due to this. That's why I tell mothers, exercise. The pressure pains that you feel on the lower abdomen, the pelvic floor muscle pain, the sciatic nerve pain, all this will be solved by exercises. All right? Thank you.